Levothyroxine can cause heart palpitations, accelerate bone loss, and deplete your body of key nutrients. This is the type of dangerous misinformation spread by Josh Axe, a chiropractor and well-known online influencer. Let's forget about the fact that Josh is not even an actual doctor and really just focus on the scientific evidence and why such misinformation can be very dangerous for the general public. First things first, what is levothyroxine? It's a synthetic form of thyroid hormone, typically taken by mouth in a capsule when your level of thyroid hormone in the body is low. Thyroid hormone is produced naturally by your thyroid gland and is really critical for regulating your metabolism, heart rate, body temperature, digestion, nervous system, and so many other key functions for your body. Now, when that thyroid gland stops producing enough thyroid hormone in your body, we call that hypothyroidism. Hypothyroidism is most commonly caused by a diseased thyroid gland, often Hashimoto's, which is an inflammation of that gland because of autoimmunity. Another cause of hypothyroidism is the removal of that thyroid gland, often because of thyroid cancer. As you can imagine, in both scenarios, we need to give our body additional thyroid hormone so that our levels don't fall dangerously low. That can make you really sick and even kill you. Levothyroxine is how we do so. Now, let's answer why these side effects that Josh is worried about are not really a concern. Josh states that levothyroxine can cause heart palpitations. Well, that's only if you're taking a really high dose that your thyroid hormone levels in your body become really elevated. A simple Google search tells you that. One of the functions of the thyroid hormone is to regulate your heart rate, and it needs to be within a specific range to get a healthy heart rate. Anything above that causes heart palpitations, and anything under that causes slow heart rate. This is regardless whether your thyroid hormone is coming from your actual thyroid gland or from a pill. When a doctor prescribes levothyroxine, they obviously make sure that it's the right dose to maintain that thyroid hormone level within that range. And if the patient does experience side effects such as heart palpitations, all they have to do is reduce that dose. I've been practicing with endocrinologists for many years, and I've never seen a patient come in with heart palpitations from the levothyroxine medication, especially when the dose is accurately prescribed. The same thing applies to bone loss. If a patient is taking a high dose of levothyroxine, then yes, they are subject to bone loss. It's just a matter of correct dosing. Now, we do have to be more cautious with the elderly population because they are at a higher risk, but that's why endocrinologists exist. They are professionally trained to give the right dose and manage any potential side effects that may come from the levothyroxine medication. Finally, with regards to the depletion of key nutrients, let's just see what the science says. I will post the question on Open Evidence, which is a reliable AI medical platform that summarizes scientific literature and medical guidelines for doctors. Levothyroxine does not cause nutrient depletion, but its absorption can be impaired by concurrent intake of calcium, iron, and certain other supplements. Now, why is this type of health misinformation dangerous to the general public? If a patient actually has hypothyroidism and they get scared after reading these posts, guess what? They're more likely to stop taking their medications. And this can be very dangerous. Just last week, I had a patient who decided to stop her levothyroxine on her own. She felt terrible and she had to go immediately back on her medication. The other concerning piece of this post is the idea of addressing the root cause of hypothyroidism instead of masking it with medication. This is a common theme we see among practitioners of complementary and alternative medicine. I am a naturopathic doctor myself, and I certainly advocate for treating the root cause. But this typically means addressing health concerns holistically. So in the case of hypothyroidism, for example, it may mean improving your diet, managing your stress, maybe screening for nutrient deficiencies such as selenium or iodine, optimizing your vitamin D levels in case of an autoimmune cause for your hypothyroidism. But levothyroxine remains a necessary part of the treatment, and we are addressing one of the root causes for hypothyroidism with a medication, and that's the low level of thyroid hormone in the body. Let's visit Open Evidence again and see what it has to say about treating hypothyroidism solely by addressing stress or leaky gut, which isn't even a real medical condition. Hypothyroidism cannot be managed solely by addressing stress without levothyroxine, as hormone replacement therapy is essential for normalizing thyroid function and preventing serious complications. The purpose of this video is not to shame or attack Josh. The purpose of this video is to raise awareness and provide some basic level of education so that people are informed and realize that health influencers may be misguiding and potentially dangerous. And the worst part is they often try to sell you supplements that are either unproven or not necessary for your health. Please always be safe and critical when you read stuff online. And more importantly, reach out to reliable sources if you have any questions or doubts.